this is Ayusha Khadka. Today I'm here to describe focus assessment related to a case study as a part of assessment task 2 of subject clinical judgment and reasoning. For the case study, we have Mr. Harry, 44 years old male, presented in ER with various symptoms and various history of modifiable and non-modifiable risk factors related to angina. As focus assessment, I have identified and categorized it into 4 different parts, taking clinical reasoning cycle into consideration. The first and foremost being rapid assessment. The second one is history taking. The third one is physical assessment. And the last one is diagnostic investigation. The very first one is rapid assessment. In this part, I will perform a general assessment of the client. I'll be looking at his physical appearance and any expressions. In case of Harry, he appeared to be pale and sweaty. And basically, I'll consider the client's situation at that point. After that, I'll use pain assessment tool, which is PQRST tool, to identify his pain level and locate the area of pain. In case of Harry, the pain level was 8 out of 10 and it was radiating to left part of his body. Then I will run some initial diagnostic test in order to rule out if the suspected case of MI, which includes electrocardiogram and collecting his blood sample. And then I'll be establishing IV line and getting oxygen supplement ready. After that, I will give priority to minimize the pain and making client comfortable. For that, as per doctor advice, I will administer antiplatelet medications and nitroglycerin sublingually and arrange IV morphine for pain management. Similarly, the next part is history taking. After stabilizing the client, I'll focus on collecting information regarding his family history, his surgical history, his medical history. I'll ask about the client, about his family history. In case of Harry, his father died of heart attack and his mother from stroke, and his second-degree relative, which is his uncle, is also diagnosed with heart problem. Then I'll move on to his occupation and his lifestyle. In Harry's case, he is father of 3 children and he is living a stressful life. And then I'll gather his medical history. In Harry's case, it is revealed that he has high blood pressure, high serum cholesterol level, and LDL level. And after that, I'll collect any sort of surgical history or any past incident of similar case. Moving forward, the next one is physical assessment. After collecting the history and noting it down, I will look after any symptoms that will point out the potential of cardiovascular diseases. As it is clear from the symptom that client is having cardiac problem, I will perform cardiac assessment on client. I'll use different techniques such as inspection and palpation to identify any symptom that might indicate the potential cardiovascular disease. For that, I'll begin with general inspection of client, and I will monitor his vital signs, which includes his blood pressure, his respiratory rate, his pulse, and then his temperature and oxygen saturation. Then I will inspect his jugular vein on both sides, which will potentially indicate any abnormalities such as distension, this will help us to rule out his central venous pressure. After that, I will palpate his carotid arteries, which might rule out the possibility of left ventricular outflow tract obstruction. And moving forward, the last one would be diagnostic investigation. In diagnostic investigation, different tests can be used to identify and rule out the condition of myocardial infarction. The first and foremost being electrocardiogram. In case of Harry, it is seen that the ST section is elevated. Similarly, the next part is we can do what I will probably do is take his blood sample and send it for any sort of cardiac biomarkers and C-reactive protein, which can be evaluated and can be seen. And in case of Harry's, there is increase in troponin I and T in his blood. So yes, After gathering all this information, I will process it and identify the problem and further evaluate it and do the necessary interventions.